So we started out looking at percent non-susceptible within 348 hospitals. We've been doing a rolling 4-quarter analysis. So every quarter we do new projections because some of these resistance patterns regionally may change. So we started out looking at observed rates, and what we found is that yes, the rates, meaning percent non-susceptible or resistant or multi-drug resistant, is highest in the hospital onset setting. That wasn't surprising to us. But then when we started looking at the sheer numbers of these case episodes, non-duplicate episodes, much greater prevalence we're seeing in the observed cases across our 348 hospitals within that non-acute care setting. So when we then applied our statistical methodologies to project the national prevalence, we were struck by how much is in the non-acute care setting. It's not unusual for us to see, for example, with ESBL producing organisms, multi-drug-resistant Enterobacteriaceae, we were seeing upwards of 50, 60+% in the non-acute care setting, even though the actual percent non-susceptible or multi-drug resistant is highest in the hospital onset setting. So that struck us, and then we further looked into the sources of these, and we found differences in sources. So ESBL is very high in the ambulatory setting, not surprisingly in the urine source, so upwards of 85, 88% in the urine source. But as we then looked at transition patients where the isolates were collected in the admission period and hospital onset, we were seeing other sources, so urine was less, but still more than 50%. We also saw differences in the types of multi-drug resistance we looked at. So for example, Acinetobacter, one would consider more of a hospital onset type of or see more resistant in the hospital onset setting. And that's what we saw, is that Acinetobacter was much higher in the admission period and hospital onset period, but we were still seeing multi-drug resistant Acinetobacter in the non-acute care or ambulatory setting as well. We also saw regional differences as well, so with Midwest and South being highest. When we look at actual projected numbers of these cases, or non-duplicate episodes as well. A lot more in the ambulatory setting, as I stated as well.